Thinking about straightening your teeth, but wondering where to start? Dr. Mori is here with answers. I'm Anita, and this is Care Experts. Today we're talking about clear aligners and braces with Dr. Kellen Mori, a member of the American Dental Association with over 30 years of experience. Dr. Mori, thank you so much for joining us today.
My pleasure.
So what exactly are clear aligners and how do they work?
Clear aligners are a type of orthodontic treatment. They are used to straighten your teeth and also to correct various bite issues. They are an alternative to traditional braces, and they consist of a series of clear trays. They are custom made to your teeth, and they are worn 24 hours a day, pretty much.
Are there differences between the different various brands of clear aligners, like Invisalign?
There are many differences. Clear aligners are made of this thermoplastic material.
Okay.
And some brands use different consistency, different durability, and flexibility. So each brand has their own software that they design the treatment. So the orthodontist or the dentist can use that to see how your treatment will be made and how many trays you're going to wear and all of that.
So how long on average would it take for someone to, say if they're using the clear aligners, to get the results that they wanted?
Each case varies because it depends how crookedness you have and how many misalignment and how the teeth are positioned. So each patient has a different treatment time, and it can vary between 6 to 12 months.
And how often would someone need to go back in between to see the doctor with each aligner?
Pretty much it takes less visit to your dentist than regular braces because we can give you let's say half of the trays during your treatment. So you don't have to go back as often. Probably you can go maybe twice or 3 times during the whole treatment.
How long would a patient need to be actually wearing the trays every day? Is it during the day, just at night?
That's a great question. So for the clear aligners to work, you must wear them for 20 to 22 hours a day. Also, you sleep with the trays in because that's the most chunk of time that you're going to be wearing your trays without removing them, let's say, to eat or to brush your teeth. So you must wear for 20 to 22 hours a day for it to work.
So after a patient has gone through the treatment and been wearing these clear aligners, when they're done, do they have to wear some type of retainer just to keep their teeth from not moving again?
Absolutely. Every time you move teeth, they want to go back to the original position. Teeth have memory. So to maintain you desired outcome, let's say you finish your treatment, your teeth are nice and straight, you must wear your retainer. For the first 6 months, you're going to wear all the time. After 6 months, you're going to wear at night for the rest of your life.
Well, I imagine, so like one of the pros of clear aligners is that you can take them out. I know if you have braces, something like that, that's not removable. So you could take it out to eat. Is there any cons of having a clear aligner? Say, do people accidentally throw them away or lose them?
There are many advantages and disadvantages to clear aligners. The advantage is they are clear, so they are less noticeable. You can remove them if, let's say, you have a photo shooting or you have, a special occasion, a wedding, a birthday. So that's a great advantage because they are removable. So in the same token, that's the same disadvantage because you can lose them. A lot of my patients lose them when they go to a restaurant. They just wrap them in a napkin or they put in their pocket and that, same pants or jacket goes to the laundry and they lose them. So that's a big disadvantage because you can take them out and lose them.
Can anyone use aligners or is there specific criteria to be a good candidate for them?
Not everyone is a candidate for clear aligners. I believe that you first need to go to your dentist and make sure you don't have any cavity in your mouth. You have to make sure your gums are healthy, you don't have any periodontal disease. So in my opinion, you should always consult your dentist before you start any clear aligner.
We'll be back after this brief message.
Thanks to CareCredit, I can take care of my best friend.
Thanks to CareCredit, I can smile again.
Thanks to CareCredit, I can be confident.
Thanks to CareCredit, I can prepare for veterinary care.
I can take care of myself again.
I can be myself again.
I can plan for Cooper's care.
I can take care of my pug family.
I can.
I can.
I can.
I can have peace of mind.
Welcome back. Let's continue our discussion on clear aligners and braces. Now, I want to talk a little bit about braces. What would the advantage of braces be?
Braces have been used for many, many years, and they are great devices, to correct really overcrowded teeth. They are, they can correct also your facial structures, your jaw, if you have an overbite, an underbite, things that clear aligners cannot do. So braces are still, in my opinion, a great device, and especially for teenagers, I
Yeah.
think. I have a teenager daughter, and she's been using clear aligners, and she loses them very often. So if she had braces on, permanent braces, that would be a better treatment.
So, how do clear aligners work versus braces? Are there advantages to one over the other?
So clear aligners, they work through the same concept. You are moving teeth, applying force, right? So clear aligners, they have customized trays that you use, and every 2 weeks you change to a different one. So the amount of pressure, it's more gentle than regular braces. So regular braces, you have brackets and a wire that goes across your teeth.
Okay.
So this force is more controlled. So braces work all the time. And clear aligners, they will only work if the patient is compliant and will wear the trays for 20 to 22 hours a day.
So, is there a more optimal age for braces versus the clear aligners?
In general, the answer is, we would like to start braces for someone that has all their permanent teeth in. So you have to wait until you're like 14 or 15 to get braces or a liner to reduce the amount of treatment that you have to do.
So I know generally you would go to an orthodontist if you were going to get braces put on, but you can also get clear aligners from a dentist. So is there anything specific that patients should be looking into when they're maybe opting to go for a clear aligner?
Like I said, it's always best to go to your dentist and see their qualifications. If you need to have braces done, you should go to an orthodontist. Not a regular dentist cannot put braces in your mouth. So dentists can take special courses so they can study the software and they can use that to give you the patient the correct, treatment.
So dentists do go through special training to understand how to use these clear aligners and sort of how to assess how many trays you would need and the length of how long you would need to wear those trays.
Yes, they should be, certified to do clear aligners.
And how much do they cost? So I know there's probably going to be maybe a varying cost depending on how many trays you need or how long you have to wear. What are the costs between clear aligners and braces?
So the cost, I would say it's pretty much in the same range. It goes between $4,000 to $8,000, and it will depend which area you go to, which state of, for instance, if you get braces or clear aligners, let's say in Beverly Hills, would be more expensive than you got braces in, Utah, for instance.
Now, would insurance cover something like braces or clear aligners?
It depends on the insurance. Some cover at least, portion of it, but it depends on your policy and if they cover orthodontic treatment or not.
And I know this might be an expense that might be a little steep for some patients. So do you offer different kinds of financing at your office?
We do. We like to offer CareCredit credit card. It's a great way for them to afford the treatment so they can have their smile of their dreams.
Dr. Mori, have you noticed maybe like an uptick in the popularity with clear aligners in the last few years?
That's a very interesting question because, yes, I have. I think because of the pandemic and how people are doing so many meetings on their Zoom, they can see each other in the camera. And I had so many patients that are like, in their mid-30s or 40, 50s, that they come to me and say, I've noticed my teeth in camera and I am horrified. How can we fix that?
Yeah.
So I offer them clear aligners.
Dr. Mori, I'm curious, how did you start your journey to become a dentist and what first got you interested in this field?
I actually became a dentist because I was terrified of going to the dentist. As a young child, I had many cavities and teeth that need to be taken care of. And my family took me to this family dentist who would not, be very empathetic. He would just strap me in a chair and I was just terrified. Like just the smell of the dental office would make my stomach churn.
Oh, no.
So I decided to face my fear and just become a dentist and help other people with deep fear. And I dedicated 1 year after I graduated working as a charity, just seeing people and kids with Down syndrome because when they trust you, they let you do anything in their mouth. So that was my deep calling to become a dentist and help other people with fear. I think, no one should have bad teeth or, pain in their mouth because they are afraid of going to the dentist.
So now it's time to do something a little fun called myth or fact. So I'm going to ask you 3 questions and you let me know if these are myths or facts, okay?
Okay.
So number 1, myth or fact, clear aligners require a special diet.
Myth. Actually, clear aligners, you can eat anything because you're going to remove them when you eat your food.
Okay, myth or fact, braces are more suitable than clear aligners for more complex teeth correction.
That's true.
Okay.
Absolutely. Braces are still the number 1 choice for complex cases where you have a lot of crowdedness or you have misalignment with your jaw. So it's true.
Okay. Myth or fact, clear aligners are only for adults, not teenagers.
That's a myth. Actually, clear aligners are for teenagers also.
Well, thank you so much for answering these questions. We learned so much about clear aligners and braces, and I really appreciate your time, Dr. Mori.
Thank you.
Thank you for watching. All of our care experts recommend and accept the CareCredit credit card, which is accepted at hundreds of thousands of provider locations nationwide. Visit carecredit.com for more information.
Through October 31st, 2023, earn an entry for your chance to win $5,000 in the Let's Get Digital sweepstakes. Enter the secret word aligners in the sweepstakes hub to earn 1 entry now. Head over to the sweepstakes hub by simply visiting carecredit.com/Let's Get Digital. No purchase necessary. Legal residents of the 50 United States, D.C. and U.S. territories, 18 years of age or older, who have a CareCredit credit card as of 9/12/2023. Void where prohibited. Starts 9/13/2023, ends 10/31/2023. For official rules, including odds, free method of entry, and prize descriptions, visit carecredit.com/Let's Get Digital. Sponsor Synchrony Bank.